I see. Then I'll have to talk without. Mike, are you using slides?
No. I'm just saying a few things. Just final thanks, really.
Yeah, well, I'll do the same then. So the slides don't matter.
Are you all right?
Yeah, I'm right.
Yeah. Okay. Thank you so much. Because
hello, Peter.
Yes, hello. Oh, hello, Raoul.
How are you?
I'm fine.
Good to know. I just heard that you sent some PDF, slides to me. When was that?
Yesterday, I think, but doesn't matter. I can just talk.
No, because I haven't received them. So probably
Right.
you can send them again. And was your email?
Yes, it was by email.
But through your email?
Yeah, my email is p.kearns@netspeed.com.au.
No, I don't have, I didn't receive anything, Mike, sorry. Peter.
That's all right, then I'll just talk.
Okay, that would be great.
We just want a few reflections from you, Peter. Anyway, three things I've learned from this seminar, sort of things. Yeah, like the Americans do. Yeah. 3 things I've learned, which they prepare in advance of hearing anything. That was also the OECD style as well.
It's true. Yeah.
It's what Jarl Bengston, who's a very nice man, did every time we had a meeting. At the end, he would conclude with 3 things he'd learned. I'm sure he'd written them down in advance.
no comment.
And probably he's using the same reflections for all webinars, no?
Wow. I'm trying hard to get through to my colleague in Iraq. I've sent emails and texts to him. So
just so everybody knows, when in about 3 minutes, I'll put the official image for the webinar for today, and then the recording will start maybe a minute before we get started at 1. And then I guess, Christina, according to who's present to start, maybe the order will be changing a little bit and not follow the agenda line for line if we're missing a few people for the start.
Yeah. Yeah. Thank you, Marie. So we're missing still WHO. So I just sent her a message.
I think they put up something in the chat saying that they were. But this is.
Yeah, that was from Bogota, from Sara. Yes.
Bogota.
Yeah.
Okay. Oh, we're not doing well today.
It's gone to this. Imagine that's loading up or something.
Yeah, well, there's people there, isn't there?
Yeah, Mike's there.
Okay, are you there?
I was there. Here I am.
Oh,
On
yeah.
top.
Hello, Monica. I see you're also joined.
Should be coming
Can you
up.
hear me?
Yeah.
I'm there. Cat man.
I better mute while you're up.
Monica, can you hear me?
Hi, good.
Yes.
Yes,
Hello.
I can hear you perfectly.
Yeah, we can
I've
hear
just
you as
turned my
well.
camera and my microphone off.
Yeah, no problem. Thank you. Hello, nice to see you again.
Nice to see you too.
Thanks for accepting to join. Quite spontaneously.
Great pleasure. Thank you for inviting me.
Thank you. Thank you so much.
Christina, I guess if for any reason we can't get to Hawk, then maybe I can say a few words because I'm familiar with what they're doing.
Yeah, I think that sounds great. Yeah,
I'm-
because it would be really a pity not to present a little bit from their
yeah.
of their work. Yeah.
You've got the slides, and I can
Yeah.
we can quickly go through them.
Usually, just check with them, Christina, because usually they come very late, or sometimes they jump during the meeting. I mean, at least this was, as I said, my experience with them. But fine, yeah.
I'll chase them. I'll chase while we're talking. Well,
I'm sorry, Mike. I didn't get. This was for WHO or for whom?
for De Hoc.
Yeah. Okay. No, that's fine. Yeah, of course.
Yeah.
No,
yes. I wouldn't be speaking for WHO.
No, because also, I mean, also they are already here. I think Monica's here already. Yeah.
Yes. Yeah.
Yeah, I think it's fine, Mike. Yes.
Yeah, but I want to get to the rest of your computer.
We're not setting them through.
So maybe if everybody can mute themselves for the next 2 minutes before we start, so we can start the recording and it's just quiet with the screen on, that would be great.
Hi, hello, how are you?
Welcome, Sarah. Thank you.
Thank you.
Hello and welcome everybody. My name is Christina Drews. Thank you for being here. We start our webinar today. I welcome you very much to today's webinar on the challenges of health and well-being in learning cities. We work at the UNESCO Institute for Lifelong Learning. And just now at the beginning, I would like to briefly say some things regarding the logistics of this webinar. It will last 90 minutes. And it's being recorded, and the recording will be available on the UIL YouTube channel. A link to this page will be shared in the chat. The format for today's webinar are individual presentations followed by a questions and answers discussion. Each panelist today will have 10 minutes to make their interventions, and I will remind participants of the time. The audience is muted, and please use the questions and answers chat room to ask questions. We will be taking the questions from the questions and answers section of the webinar during the discussion session. And when you write in the chat bar, make sure that you write to all panelists and all participants, not just to the panelists. So very pleased to welcome you today. Since June 2020, UIL and Pascal Observatory are hosting each month a virtual meeting on a specific topic relevant for learning cities around the globe. And the aims of this series was first to highlight important and challenging aspects of learning city development, drawing on research and development work in both Pascal and UNESCO UIL learning cities. And secondly, to demonstrate the practical applications of successful practices in learning cities. Only 10 days ago, we hosted and participated in the online conference of our health and well-being cluster. It's coordinated by 2 cities, by Cork in Ireland and Osan in the Republic of Korea. And this first cluster meeting was entitled Learning for Well-being, Strengthening Resilience in Learning Cities. And one of the objectives of this meeting was to find and determine research priorities and actions to be taken for the 5th International Conference on Learning Cities coming up in 1 year in autumn 2021. As I'm speaking to you today, in Germany, we are facing again another harsh lockdown. And so this global pandemic is really affecting everybody. It's affecting every aspect of society. And it has brought into sharp focus the importance of staying healthy. There is a lot of trauma, a lot of mental trauma. So mental health experts say we may also experience a second wave of mental health issues related to the pandemic due to the high level of stress, a lot of emotional trauma, and of course, financial disturbances. At the same time, we see planning and policy making more inclined to public health investments. We see efforts to promote diverse and cohesive communities together with sustainable environments and stronger local economies. There is definitely a greater interest in the impact of urban environments on health and well-being. And today we have the chance to listen to the experiences on the local level in tackling these areas. So we are joined by speakers from the World Health Organization. Then we'll jump to Latin America. We have the Colombian capital with us today. And afterwards, hopefully, we will be joined by a representative from Iraq. And we will also hear from Professor Mitchell from the University of Glasgow. But first, I would like to give the floor to my colleague, Mr. Raúl Valdés-Cotera, and he will do some introductory remarks. The floor is yours, Raúl. Thank you.
Thanks a lot, Christina. It's a pleasure to be here today with you. I would like to welcome all you to this webinar on the challenge of health and well-being in learning cities. As Christina said, this is the 6th and the last webinar of this series that the UNESCO Institute for Lifelong Learning is organizing in collaboration with the Pascal International Observatory. And you know, when last year in 2019, members of the UNESCO Global Network of Learning Cities acknowledged health and well-being as one of the most important topics of the network to focus on, None of us really could predict that the year to follow would challenge societies around the world with a global health crisis. And with this, the pandemic, the importance of quality health education has, like never before, become so evident. COVID-19 has led to global learning disruption of an unprecedented scale and severity. This has been reflected in the closure of schools, universities, and other learning institutions that has affected already the lives of 1.6 billion students in over 190 countries. The UN General Secretary warned earlier this year that the pandemic has amplified social, economic, and digital inequalities, putting a generation at risk of a learning catastrophe. But at the same time, it has helped showcase the role of education as the pillar for every society, as a public common good and the bedrock of social cohesion, well-being, and opportunity. I think both health and education are a central focus of the United Nations 2030 Agenda for Sustainable Development and its 17 sustainable goals. WHO declared that without health, the common goals and urgent needs will not be reached. No doubt about it. And this statement is equally relevant for education. More than ever, we are testimonies of the connection between all SDGs. While education stopped, learning did not. The UNESCO Global Network of Learning Cities has worked hand in hand to share its solutions to not only providing learning during the pandemic, but also overcoming the crisis itself. The cities during the webinars, conferences, meetings, workshops have discussed collaboratively the issue of learning being out of formal and non-formal education, and expanding with measures, campaigns, and partnerships work best. Some city members report now that they had rediscovered the importance of intergenerational family, neighborhood, and community learning, while others shared concrete initiatives. We have learned that young and old are affected by stress and insecurity. Maintaining psychological, social, and emotional well-being has been a challenge for all members of the education community, students, families, teachers, education assistants. Those who work in education, families and communities must develop vital emotional resilience skills. And with this same framework, socio-emotional learning is a valuable tool for mitigating the harmful effects of the social and health crisis and conditions for learning. These require accompaniment, support, and resources that are specially adapted for this purpose. Lifelong learning, we know that can take place in many different contexts, and today, cities have a strong role in supporting that dissemination of knowledge in the area of social confinement, helping people to maintain health and hygiene and engage in new learning opportunities. And as mentioned by our director, Mr. David Achuarena, as well as avoiding any disruption in learning, cities are well placed to transform not only schools, but also the entire lifelong learning system into a massive preventive resource. Lifelong learning institutions are called on to promote the behaviors, gestures, and habits that can prevent contamination. With a few weeks, prioritizing health education for all citizens and not only children has become a global priority. With this idea, I will wish you a rich discussion in today's webinar, and willing very much to hear from experts, from city representatives, what is happening in today's local life. Thank you very much, Christina.
Thank you, Raul. Thank you for this introduction. As I said, we're very pleased. We have the World Health Organization on board, and it's Ms. Monika Kosinska who joins today. She's responsible for the important work of the WHO European Healthy Cities Network. She's an expert when it comes to urban health, and she organized actually the annual meeting of the European Healthy Cities Network last week. And I'm sure she has some brand new information to share with us. You have 10 minutes, Monica. Thank you.
Thank you very much, Christina, and thank you to Raoul and also the network for inviting me to speak to you again today. It's a great pleasure to be able to join you, although we meet us at the end of what seems like a very long year, I'm sure, for everybody here. And thank you, Christina, for introducing the events that we had last week, because I think that there has been, first of all, it was a great pleasure for us to host so many cities who we have in partnership, including Bogota, who spoke at the conference. We had about 2,000 participants over the 3 days. So this was really for us unprecedented, and really indicated just the extent of the work that we all know has been going on, and indeed you have been addressing in your work as a network over the last 8-9 months in this regard as well. I don't think I need to tell any of us here just how critical cities have come to the forefront in last year with regards to the pandemic. We saw cities becoming the national epicenters of the pandemic, and still in many cases there are, as we are not even in coming to the end of this situation just yet. And we saw cities at the forefront of the recovery. And regardless of the heterogeneity of our cities, the differences, particularly I work in the European region, we have a very diverse region, although our cities are generally quite small compared to the global average. But that regardless of the diversity, what we saw certainly this year was the challenges and the common challenges that we felt run through. And health, we've always known, and is a common challenge. The global burdens that we see, the trends are not unique to one region or indeed to one city. Before COVID hit, we saw rising inequalities, we saw, including in health differences between socioeconomic groups, between groups at risk of vulnerability, as well as between cities and between countries, or cities within countries, but also between countries themselves. We saw rising tides of non-communicable diseases. We saw that we still had not succeeded in tackling the unfair burden of communicable diseases. And it was really through these veins of inequality that we saw the pandemic run. And this as a reminder of us, and thank you to Raoul for making that point so strongly and so well, that these are fundamentally interconnected. We cannot separate out the Sustainable Development Goals. They are indivisible. And we saw that in its hardest form in terms of the pandemic and the response here. And we also saw the importance of networks such as the Healthy Cities Network, but also networks such as your own. These are not things that we can build in times of crisis. These are platforms that we can utilize when we need them, and the partnership between the two networks has been very important for us. And the response and the actions, the joint actions that you have taken to learn from one another, to share your experiences is fundamental in our own resilience, as well as contributing to supporting our communities. And that community connectedness and relationships has been the real added value in terms of the city responses. It is the closest level, you are the closest level of government to the communities themselves, and it is the community responses that have made the difference. Even as our most sophisticated health systems were overwhelmed, the success and failure of our response efforts lay in the ability of our cities and our communities to be able to support one another when they needed to. And very quickly, and I do not need to tell you this at all, that the issue of learning became one of the hidden emerging issues that we faced within the pandemic. And the demonstration of how learning and education, how fundamental this was, not only to community and social resilience, but also well-being, mental health, and indeed inclusion or exclusion. The veins of inequality that we have running were manifesting themselves in our ability to continue to have access to learning. And your role here has been phenomenal and very impressive for someone like myself to be able to witness and to experience this through the meetings that we've had together. And so our challenge now really is to maintain this learning, that our own understanding and the demonstration of how interconnected our areas are, and take that forward as we move into the recovery. We cannot forget, we cannot lose that lesson. Investing in learning is an investment in health. We know how fundamental education is in determining not only how vulnerable we are to diseases, whether they are unexpected or ones that we know are looming, such as non-communicable diseases, but also how fundamental as an intervention, how fundamental education is to inoculating us against inequality and deprivation as a society and as individuals and communities. Investing in, as part of our recovery efforts, in ensuring that we continue to see education as an investment in education, as an investment in health, in well-being, and in social development is a challenge that we have not yet won, and it is critical that we maintain that at the forefront of our minds as we move forward. And so my final point is that in that interconnectedness that I think it is very difficult for anyone to argue against now, although this is something that we've all known for some time, the role that cities play in those relationships as actors and as advocates for the common approaches and the synergies that we have between the different sectors, between the different agendas is quite critical. And so my sincere congratulations to all of you, including UNESCO, for the impressive and excellent work that you are doing. And thank you very much for the opportunity to be here, and I'm looking forward to our continued collaboration as we move hopefully out of the pandemic and into a more healthier future for all of us. Thank you.
Thank you, Monica. Thank you for this introduction as well. And I think it's really interesting, your remark that given even the very diverse cities in your network, I mean, you reached out to 2,000 people last week. There are really universal problems we're facing. So, I mean, hence the interconnectedness is really very obvious. Thank you. We are also looking forward to continuous collaboration. And I think we will have now the next speaker will come up with some very practical approaches. Let me welcome Mrs. Sara Valencia from Bogota. She is director of the district's research center for health education of the Health Secretariat in Bogota. And she speaks on behalf of the mayor's office of Bogota. And I'm not sure. Yes, the presentation is on. So can you hear us? Good morning to Sara.
Good morning. Good morning, everybody. Thank you for hosting us for this invitation. We want to share with you some of our experiences through the pandemic related with education, well-being, and health. Our research center has been focusing on three main areas. If you can proceed with the next slides, please. So in our case, we have as a goal to transform through education, cooperation, and research the health and well-being of the different actors in the city. So the next one, on the health area, we have one specific objective, that is to promote, develop, and consolidate educative strategies to transfer knowledge on health professionals and the community on key health topics. And as the previous speaker was mentioning, education is quite important, not just for the training of professionals and health professionals that has been quite crucial here in Bogota, but also is because education is a health determinant and also can decrease health disparities, and health professionals also requires content knowledge transfer. And health literacy has shown an important effect on how people can face different diseases and can prevent. Also for us, it was very important not just to teach people about biosafety, about the diseases, how to manage the different protocols within the healthcare institutions, but also that people through different strategies can be health promoters in their own communities, and through peer communication and different actions, they could develop a sense of responsibility of how to face these challenges that the pandemic was putting us through. So that was quite important. And so I'm going to show you 3 different strategies that we have been working on over this period of time. So please, the next slides. So here on the right hand, we have cities actions. We have a program at the Secretary of Health that is called Art and Health. And what we want to promote is through different art expressions in different areas, not just in hospitals, but also through community activities, how art can be a vehicle to show us how to face different mental health situations. So in the next one, in the communities, we had a program that was called Health Promoters. So it was with people that were delivering different foods and goods, and people in the drugstores were telling others how to take care of themselves. And also they were part of a strategy to correct bad behaviors on biosafety. And the last one is our training strategies for health professionals and all different areas, and healthcare units and IPS, like providers of health, from the bodyguard, how to guide people through the process in the institution, to the high specialists, how they could manage on all the protocols that they could implement to face the disease. So I'm going to go quickly for the next slides, please. So in the Art and Health program, we have 4 different areas that we are working on. One that we are implementing right now is the time capsule. So what we did is a call for the people in the city to show to us and to the city how they have been facing the pandemic throughout all this time, all their emotions, because we had a really long confinement, and for us, we faced different expressions and emotions over this period. We faced depression, anxiety. Sometimes we want to hug others. For other people was a time to reflect on themselves. So people painted, drew, took photographs, they write about their experience. So it was a way to connect emotions and how all of us, despite being in our home, a little bit separated and just interacting through these cameras, also were experiencing similar feelings, and how telling those feelings can be also healing. And when you connect on others through emotions, that creates also as a society a connection. And we wanted to reflect on that. We know that mental health is going to be one of the critical points on the future, and the effect that the pandemic has had on mental health. We will see those results in the next years. So we wanted to see how people were experiencing that. So we have this time capsule. We have received plenty and a lot of different expressions, and we want to present this result of these art expressions next year to the city and to the world, to tell people how we live through this period of time. So that's part of our strategy to connect and perhaps to well-being. Then we have our online virtual education platform. We have different courses there. And one that is quite important, the next one, is the one that I was mentioning before, that we had a route for healthcare people working in different institutions. So we trained them through this platform on how to manage the different stages of a patient within the institutions, and it has been quite successful. We have had more than 35,000 people trained through our website and our platform. and it have helped develop different capabilities, how to manage sample, how to manage patients. So it has been focused on health professionals and of people working in institutions, and it has been quite useful for us. And the last strategy, we can go to the next slides, is what we call health promoters or care promoters. In this case, it was a very community-based program that allow people to know that they have a key role in this pandemic. So it is not just a government issue, it's an issue that depends on our behavior, on how we interact with people, how we take distance measurements, how we wash our hands. So it's part of health literacy, but it's not technical. It's more about how we relate with others. So this strategy was looking for people that interact with others on daily basis, as I mentioned before, delivery guys, people at the drugstores, people selling in different stores in the city. So they were trained on how to promote all the different biosafety strategies, and it has been also quite successful. And we have found a lot of engagement with the community through these strategies. So we wanted to share with you these 3 different ways to promote health and well-being through the pandemic. Of course, we are talking from our strategy and experience from the health sector, but there are also other strategies from the education sector that they have been continue teaching through these platforms, but offering different strategies to take care of the students. So all the healthcare that they were providing within the institutions have been provided at their homes. And this has been also one of those experiences that we can share with you and with the world. So thank you for this opportunity. These were the 3 topics that we wanted to show you in a very practical way to connect with people and to get different results on health, mental health, on training of health professionals, and also working at the community level. So thank you so much.
Thank you, Sarah. Thank you for these insights and very practical strategies. And I'm really eager to hear also from the experts. I mean, to listen to their reactions to your practical examples you just gave. I think it's really very progressive to also use art as a vehicle, as you said, in this whole treatment and tackling the health and well-being. And I think you also, showed again the connectedness of learning, education on the community level. And thank you again for presenting these successful practice examples. We will now move to our next speaker from northern Iraq. Let me welcome Mr. Dr. Halim. And Dr. Halim is the focal point in the city of Duhok in Iraq. He's the focal point for health project activities related to internally displaced persons and refugees. He's a pediatric specialist, and I'm really looking forward to listen to him and to listen to the presentation.
Thank you very much, Christina. Good afternoon.
Good afternoon.
I think my sound is clear.
Yes, very clear. Perfect.
Yes. So as you say, I'm Dr. Azad Abjabar Halim. I'm assistant professor of pediatric. I'm the vice manager of Heavy Pediatric Teaching Hospital, which is the main hospital in our area. And also I'm the assistant professor, head of pediatric department related to the University of Duhok. Yeah, next please. Yeah, next one. Just I would like to give you some figure about Duhok. So Duhok is a city is located in the north of Iraq. It's near the border of Turkey in one side, in the other side near the border of Syria. So regarding the learning city, Duhok became a learning city. It started at 2012. Duhok population previously was about 1.2 million, but nowadays it's 2.2 million. And 40% is estimated to be pediatric population. So about 880,000, they are less than 18 years. Why Duhok now 2.2 million? Because we have many people, they are refugees from Syria, and also we have internally displaced people. So suppose that at the era of ISIS in 2040, there were more than 60,000 delivery at Duhok. Next, please. Yes, us to introduce Duhok as a learning city. For building a learning city is a collective and a continual journey. So what we need a planning, need involvement, celebration, accessibility, monitoring, evaluation, and also we need funding. Next, please. Yeah, so at the beginning, what we have to put a plan or making a team. So the team in Duhok City for the pediatric, we have pediatric specialists from the health side, and also we have lecturer of pediatric from the university side. I will give you an example. So the manager of main pediatric hospital, he is lecturer in pediatric department. And I am the head of pediatric department. I'm the vice manager of the heavy pediatric hospital. So the team is composed from the university and from the health. We have also the help of the local and international organization, like local heavy organization and WHO and ISPO as an international organization. Oh, we should not forget the community also health. So we have politicians, religious, and usual people who are putting with us for the monitoring and helping us for building Duhok as a learning city. Next, please. Yeah, at the beginning, we put a strategic plan. We have main three corners, which is very important. The first thing is what increase the health service to people. We would like through the university and from the educational sector to give service to people. The second thing is that for the future plan, improvement of the medical college syllabus, because those are the future doctors. And the other important thing is that we would like to transfer our experience to the near city. So these are the main strategic plan. Next, please. Let us to say about the role of University of Duhok. So in Duhok City, University of Duhok contribute and engage in the various fields of the development, like in health, agriculture, infrastructure, environmental protection, planning, cultural activity, and also tourism. These are the role of University of Duhok. Next, please. So what's about the medical education? As I said, we try to change the syllabus of University of Duhok from the classical discipline basic system to outcome-based integrated system. Until now, third-year medical students, they are following the new integrated system. Next, please. Yeah, we also try to share our student in the university for the community learning. Yeah, so as you observe in this cartoon, you will observe our students, they are sharing in the awareness of many days, international days and awareness, like in short stature day, diabetic day, hand washing, even in COVID-19 era. We try to share our student for teaching his people, for example, how to wear the mask and to educate them about the COVID-19. Also, they are caught in HIV, hepatitis, and also they are all sharing in the festival in Duhok City, in the large public garden, and also in the mall. So next, please. Yeah, what's about the media level? As a lecturer in university, we try to do an interview in the local, national, and international, also radios and also television about the weather change awareness, about the common pediatric disease, including COVID-19, and about immunization. So next, please. We have very, very important and interesting subject, that's psychological support. Yeah, so STIPKA is a crisis intervention program for children and adolescents. So it's one of the best Swedish program for prevention, detection, and treatment of psychologically traumatized children. We have two important trauma in our locality. The first one is ISIS war, and the second one is COVID-19. Till now, we have 30 medical doctors and nurses. They are working in this field. Yeah, next, please. Next one. Next, please. Yeah, what's about the woman? For the woman better health, we have a special center for the women in our area, which is called WE Center. So it's special for the education of women and the health of the women. As a university sector, till now we have 10 separated seminars about the infectious disease for women and different sectors from the campus and outside the campus. Next, please. Yeah, very, very important subject is online management. As a pediatrician and from the all field and all department, we share in the two important online program. The first one is called Doctor Online, which is on the one of the international television. And the second one, you can visit the University of Duhok site. You will see they are writing Ask Your Doctor. During the COVID-19 lockdown, we treat many patients and we help many poor people to treat them online. And next, please. Yeah, I will give you an example of the Hivi Hospital, which is the main pediatric hospital before 2015. Previously, University of Duke was not included in the system of the university or of the hospital. But after that, we are including ourselves for treatment of the patient. So 2015, we built neonatal intensive care unit. 2016, we built the neonatal intensive care unit. And after that, we have semi-intensive care unit, surgical blood department, and after that, triage system in hospital. And now we have building a very good hospital in the area. Next, please. So these are in this cartoon, you will see opening ceremony, a celebration of the pediatric surgical ward, and also the next one will be pediatric emergency. Other important thing, which is very important for the all university and sector, is TOT, training of trainers. Till now, we try to do training for the many staff of the hospital and also in the community. Regarding from the university side, we have 300 trainee trained, 50 trainer of training, and internship in the Italy for the Hivi hospital, and also for the same person, they are expert in the pediatric management. Next, please. Supporting cancer patient. Previously, we have many complaints for those people, especially children. So now I'm the head of pediatric department and also the head of fundraising project for the cancer patient from the dog, and in the coming collaboration with the dog governorate since 2017. We save life of many patients and we bought many medication for the cancer patient. So next, please. Peshmerga level. Peshmerga, those are the fighters who fight against ISIS. So in the collaboration with the medical soldier from the UK, USA, and Sweden, we train 110 Peshmerga in full training course about the combat life support in 2015. Until now, we are continuing to educating them about the medical aspect of the regarding the combat life support. And we visit them many times in the frontal line in Mahmoudiya, which are they are very near ISIS at that time. So next, please. Also, as a specialist of pediatric, I am the lecturer of university, also the specialist of pediatric infectious disease. I'm the head of the team for prevention, awareness, and treatment of the critically ill patient, all people who are less than 18 years. Yeah. Also, I would like to share with you about my private clinic. The private clinic also, as from the university side, one of the staff of university, free medical service to internally displaced people and refugees for 1 year from 2015 till 2016. And also we offer free medical service for orphan children from 2015 till now. So next, please. We have many projects, so some persons should monitor us. So the monitoring was through the WHO and also from the ESPO, which is one of the organization from Italy, and hopefully through all this project, the mortality rate within 1 year reduced to less than 22.5% if you compare with the previous year. The next, please. So this will be the last slide. Really, from the university side, we try to obtain many funds from the WHO, from the ESPO, from the European Union, from the Germany, Japan, and Kuwait. And one of the many important things was the renovation and expansion of the main pediatric hospital, which was about 1,200,000 euro. And at the end, I will say thank you very much, and we have greeting from Dog City. So the next slide will be the photos of my city, and thank you very much for this opportunity. Thank you, Christina.
Thank you, Dr. Halim. This was really interesting, very informative. And I think it shows also well the very different layers. So beforehand, we heard about arts and education, and now we see that your city is dealing with so many different challenging aspects. You mentioned the women, the displaced person, the ISIS conflict. There is a question for you in the chat. Maybe you can just answer right away if that's fine with you. So if you could please share with us maybe some data about the COVID-19 diffusion in the city and in Iraq, if you have that data maybe.
Yeah, really regarding our city, because we have a special team for the pediatric, Regarding the pediatric, till now we have 1,700 child infected with COVID-19, and unfortunately we lost 7 patients. But the other interesting thing is that we have other disease which is called post-COVID syndrome or pediatric multi-inflammatory systemic disorder. We have more than 50 patients. They become very tired after COVID-19 after 2 weeks. So they get inflammation all over all the system of the body. We observe in our locality, because from the beginning we detect many child, and now we save the life of many patients. So COVID-19 in our locality, we have many patients. And regarding the death, in all ages, per day we have 20 deaths per day.
Per day in the country of Iraq?
No. I mean in my city.
In your city? But that's a very, very high
Yeah.
number. That's a very high number. But it's
Yeah.
also interesting, the remarks on the long-term lasting effects of COVID-19. Right. Okay, thank you for reacting so quickly. So that was a very different case, the city of Duhok. And I think it was also interesting to see that how the increase of inhabitants in your city. So this is also not a minor aspect to consider. Thank you so much. We will move now to the next speaker, and all the speakers are very good in respecting the times, so I don't have to mind anybody. So let me welcome now Mr. Mitchell from the University of Glasgow. He's professor of health and environment, and he's also leading the Neighborhoods and Communities program at the Glasgow University. And he focused very much on the roles which environments can play in creating, maintaining, and perhaps reducing inequalities in health. So very eager to listen to you. You have also 10 minutes. Thank you.
Okay, thanks very much. Thank you very much for the invitation to speak. It's lovely to meet you all. So my plan for just 10 minutes is to talk a little bit about how my team and I think about health in cities, and particularly to think about neighborhood as a unit of analysis in our research. And then just to give you a couple of examples of the kind of research that we do, which I think weaves together some of the themes that we've been talking about this morning. And you'll be pleased to hear I'm not going to talk about COVID, so you get 10 minutes where you don't have to think about it. So next slide, please. So fairly obviously, when we think about health and well-being in cities, some aspects of the environment, and that's what we're interested in our program, have the potential to hurt us. Next slide, please. But it's really important when we think about health and well-being in cities that we remind ourselves that some aspects of cities, for example, the presence of natural green and blue spaces, or social systems, or indeed education, have the potential to keep us well. Next slide, please. Now, when we think about neighborhood, it's really important to understand that we have different rates and different states of change, and that provides a very interesting laboratory for us to understand its influence on health. So some neighborhoods stay the same. So that was Venice, off the beaten track, and you can imagine that really life in this part of Venice probably hasn't changed very much for decades, if not hundreds of years. But next slide. But obviously some aspects of cities are changing very rapidly. Indeed, some new cities are emerging almost literally overnight. Some neighborhoods change. Now this is important. Next slide, please. Because it's important that you understand that the neighborhoods, the environments that we live in, are not simply some kind of test tube in which we live out our lives. They are part of our social and health systems, and they shape those systems and indeed are shaped by them. So it's a complex relationship between the two. Next slide, please. Next slide, please. Thank you. So when we think about health and well-being in cities and learning cities, sorry, can you pop back to the previous one, please? Thank you. They're obviously interlinked in a dynamic city system. And when we think about the science of this, it's important to understand that there are no independent variables in a city. So we cannot, for example, separate out health from learning and from education. And I think that point's kind of been alluded to already. Next slide, please. So in population health and epidemiology, this is how we think about the wider determinants of health. So we understand that our health as individuals are a function of all sorts of wider circumstances. Now, it's important to recognize that obviously healthcare services are important, but in terms of population health and inequalities, they are in fact a relatively small component of the determinants of health. You can see all these other factors and education amongst them. And it's not only that education affects our health as individuals, it's that all of these things connect together with education to affect our health. Next slide, please. So this relationship has already been alluded to. We see strong relationships between the level of education, for example, that an individual has and their health and well-being. These are data from the Netherlands, for example, and you see a change in life expectancy as education levels increase, but also crucially, a change in the experience of healthy life expectancy. That's how long we might expect to live in good health and well-being. Next slide, please. And we see this relationship not only in the economically developed world, but also economically developing cities. These are data from Argentina showing a very similar relationship. This is the social patterning of diabetes by education. Next slide, please. So here's my key message. I need you to think about neighborhoods and cities as like fields. Okay, so we're growing lives rather than crops. But the important message is that if you get the environment right, it nurtures healthy people generation to generation. That's the key issue. So neighborhoods continually reproduce the same kinds of people generation to generation. But if we get it wrong, the adverse consequences are perpetuated. Next slide. So let me give you an illustration of this. Here's a neighborhood that I visited as part of the SHLC. This is Kigali in Rwanda. And you can see these are kids coming home from school, but you can see the kind of neighborhood environment they live in. You can see the kind of housing that they deal with. But those kids who are running up the steps, if they kept running to the top of the hill, next slide, this is the kind of neighborhood that they would encounter. So different neighborhoods in the same city, in the same country. And you can just imagine the differences in terms of education and learning and health that growing up in these two contrasting neighborhoods would bring. Now, I've got a great illustration here of how I can show you that this stuff really matters. So a study we completed a little while ago looked at the social geography of London more than 100 years ago. So in 1896, a man called Charles Booth surveyed London, and he actually coloured in a map according to the social class of the people who lived in each kind of house. Next slide, please. And we took these data from his map, we digitized it and created a poverty index for 1896, and then compared the geography of poverty in the city 100 years apart by using more contemporary census data. And we found an incredibly strong relationship, so much so that we were able to predict contemporary geography of death rates using the data from 100 years ago pretty successfully. Next slide, please. So if we know that place affects health, then in theory, it should be a lever that we can pull to improve health and well-being in a learning city. So what might these levers be? And I've just got a couple of examples from our research here. We use a lot of GPS data in our research to study how people use the city and where they go. These are GPS tracks taken from a child, and we've extruded the tracks by time. So the tall chimney there is their home. They spent most of their time at home. The second tallest chimney is school. And we're interested in how learning means that kids interact with their city in particular ways. Next slide, please. So we've been able to track, for example, the way in which kids came into contact with places that sell tobacco and alcohol. And this is a graph of how that varies through the day. So the orange bars are weekdays, the kids are in school. And not surprisingly, there are peaks in exposure before school and then immediately after it, but a very different pattern from the weekends. So when we think about education as a landscape in our cities, we need to think about how that affects exposure to potentially harmful substances as well. Next slide, please. We're also interested in how the journey to school and after school relates to physical activity. So we've constructed an agent-based model. This is a computer simulation of a neighborhood in which kids go to and from school, they interact with their friends after school, and the environment that they live in has an influence on whether they take physical activity. And the beauty of a computer simulation is that we're then able to apply policies. So this graph illustrates some different policy ideas about when and where in the kids' day could we get them to take more exercise? Can we encourage them to spend more time in the neighborhood and therefore perhaps play football after school? Should we have those policies in the school day? Should we try to combine these together? Next slide, please. And finally, I just want to draw your attention to something. I don't know whether you're aware of this, but there's a really interesting tool that was developed in Scotland called the Place Standard. Now, this is a questionnaire that you can apply both as policymakers, but also as a member of the public and a citizen, which asks you about aspects of the place in which you live, and is a really interesting way of drawing together all the elements that contribute to health and well-being in terms of thinking about the systems of cities that we live in. Next slide, please. Just to acknowledge that I'm funded by the MRC, the Medical Research Council, and the SHLC is funded by the UK Research and Innovation Group. That's all I've got to say. Very happy to take questions. Thank you.
Thank you, Mr. Ritchell. That was really very informative. And I mean, you did not mention COVID-19 at all, and still this was so very informative about the relationship between where we live and our health and well-being and our life expectancy. And I think it was very, very interesting to see the very modern tools that you're using, and also interesting, but also maybe a little disappointing to see the little change with the simulation you did with comparing London 100 years ago, and then with a comparison to the more recent dates. So yes, thank you. I'm looking at the questions. I think we can now move on to some questions and answers. And I already have one for, yes, the city of Bogota. So there is one question about the, yes, media literacy competencies at the community level. So maybe Sarah, if you are willing and able to take these questions.
Yes.
Yes, thank you.
Perfect. Yes. What we are doing right now is try to understand how people have been engaging with different social tools and these media devices at different levels, like children schools and the access that they have to technology and how well they employ it to define better routes or to provide them some training. So what we understand right now is for health professionals, it is a really well-known tool and they can use it properly. What we have been facing is that at different levels, when people doesn't have proper education and their access to technology is limited, their media literacy is low, so the strategies are different. So that's the reason why engaging directly with community and just through these technological devices is quite important to detect when people were having direct interaction, so we can overcome this media literacy deficit that we find in some areas here in the city.
Thank you, Sarah. I think it's also, I mean, that's what we encountered also recently during our health and well-being cluster meeting. It was very well attended last week. And so the topic also comes up, of course, health and well-being and the use of, I mean, the massive use now of digital applications. So it would be also interesting to hear from our panelists about that, because that's also something new that we're encountering, the massive use of digital applications, computer technology. So I'm not sure if anybody would like to say something about that. And otherwise, I have one question for, yes, Sarah, you want to?
I just want to mention to comment that. So when you talk about media strategies, also you need people to have the devices, and that was a barrier that was encountered here in Bogota. When you have people going to school, like all the students, and at home they just have one computer, one cell phone. So the city created a strategy so people can donate tablets, computer, and it was a strategy within the city to donate and to collect money just to provide those devices to students so they can access to the classes and they could join and to keep up. So this revealed the technology gap that we have in education here. So when you have people having one tablet, one laptop, and they come faster to catch up, you had others that were left behind with technology. So the pandemic also made that Bogota had to take strategies and to develop a way to provide this technology. And with that, to provide some media literacy, not just to the social media and all Twitter and those, but also to engage with these tools that we are using right now on our daily basis.
Yeah, I think that's I mean, that's happening, I mean, all over the world. And also even in Germany, we have these inequalities of who has devices and who has not the right devices in these times. I have maybe also, there is the question to Mr. Mitchell, if you could answer, take up my question, but I also have another one for you. It would be really interesting if you can give some maybe strategies. I mean, what options can you give to cities who are interested in implementing strategies for health and well-being, including for our learning cities? So maybe you have some tips to share with us.
Oh, sorry, slight video problem there. Yeah, it's a really interesting question. I think understanding the connection between things is really important, and taking a system science approach. That's certainly the way that the kind of work that I do is heading. It's one of those things that's very interesting and easy to say, that we should understand that everything is connected to everything else. It's one of those things that's actually quite hard to do in practice. And one of the problems is that certainly in the UK, government and policy is very fragmented and broken into silos. And although there's a lot of discussion about everybody sharing and talking and sharing priorities, in reality, we don't have a minister for everything. You know, ministers have their particular functions and roles. I think the issue around education and continuing learning is very important and not very well tackled, I have to say, in the UK. With regards to health and well-being, though, I think there is an opportunity to deal with that. And as we consider, for example, the challenges in the UK context of social care, and understanding the focus and attention that there needs to be on both the very aging population, but also the population that are trying to support them, i.e. usually their children, people aged kind of 40 to 50. That may be a little window and an opportunity, a point in time in which we have a number of generations connected together with a common purpose. And perhaps that's a place for interventions around adult learning and interventions. I don't know if it could work, but certainly that's one of the ways in which we're thinking about these is trying to see opportunities where things are connected and where people are connected, and to target our interventions at those kinds of places. I don't know if that helps or not. That's just my
very interesting idea. We also have another question for you. Maybe I just continue.
Sure.
From Professor Ramirez, all the way from Ecuador. So he asked if there is any data on how adult education policies have changed across this year, and if adult education policies today more inclusive to generate support of parental skills needed by parents, and how can they positively impact new generations? So, I mean, he's also referring to the different generations.
Yeah. So, you know, I need to emphasize I'm not an adult education specialist. I'm an epidemiologist. So this is slightly outside my comfort zone, and maybe Mike will come and rescue me in a minute. But I think this idea of generation to generation production, the idea that neighborhoods are basically fields or factories, if you like, for the recreation of society is really important, because it explains why we're so bad at reducing inequalities and reducing the differences between different types of people in terms of their outcomes. Certainly in my world, we don't tend to study adult education. Typically, our measures of education that we use in our epidemiology is a marker of the end of formal education. So certainly we run models looking at how many years education people had and what they attained. But, you know, it would be almost unheard of, for example, for us to include whether somebody was in continuing education as a predictor of their health and well-being, which is a really interesting situation, and I think is an illustration of this silo, this disconnect between people involved in education and learning and people involved in health. But we are beginning the process of trying to understand much better how neighbourhoods can be implicated in both of these problems.
Thank you, Rich. Thank you. And perhaps other speakers could also, reflect whether they agree with the observation that often learning is relegated as a priority in urban debates. So it is just related to what Professor Mitchell has been just saying. So why does that seem to happen? So maybe somebody else. And I'm sure that Mike will also get back to the question on adult education. Maybe Mike, you want to say something right now?
Well, it was just an observation on my part that that learning is relegated often in most urban discussions, whether it be around healthy cities or cultural cities or whatever. And Rich has just made the observation that adult education in particular and learning beyond schooling is often not used in studies that he is involved in, and I'm sure it's the same with other people who work in his area. So it really was an observation on my part, and I was trying to induce other panelists to reflect on that and whether they find it's their the position in their countries as well, and reflect on why that might be the case, because we do see in policy documents that if they don't come from the field of education itself, there often is no mention of education. So I'm just really making an observation at that point for others to reflect on.
Maybe we can also go and ask Dr. Halim. Is he still with us?
Yeah. Sorry.
Yes, since you're working at the university, so you show that you're really trying to interconnect the both fields, education and the health sector.
Yeah. So really, just I would like to tell you, after the COVID-19, we try to apply many systems in our area. So at the beginning, we try to educate medical students only through the online, but in the health system, I think it's not so beneficial, especially for the first year and second year medical education. I will observe, because it's any new thing that we give only online in practice. Before 6 months, we announced that this type of teaching is not good. And after that, we try to participate the student and to bring some student in the hospital to train them on the patient. But unfortunately, we have many students, they are infected with COVID-19. And also we have many lecturers, they are also infected. Really, nowadays we are using the system that we distribute as a student through all the weeks, but in the very small group. And if any person we observe them, they are infected or they have signs and symptoms of COVID-19, we try to separate them. Even for examination, we have a special hall for the suspected cases of COVID-19 during examination of the student. And we try to put those students with some newly infected lecturer. But to say the process of teaching is good nowadays, no, it's not so good like previous years, because we observe the student, even psychologically, they are not good. Regarding the children in general, as I mentioned in my presentation, we have a new program called SIPCA, which is the new system for the assessment and also for diagnosis of the traumatized child, psychologically traumatized child. I observe many children, they are psychologically traumatized. And we observe most of the people, they are visiting us in the private clinic, they are complaining of some somatic symptom. But during dealing with those people, we observe they are psychologically traumatized. This is why you will see also, you'll notice in the future years, we will see many psychologically traumatized people because of the COVID-19. And we should work on this subject, because for me, it is very, very important and interesting subject. And also the UNESCO also should try to concentrate on this point, not only to distribute the knowledge. No, we have to serve and prevent this trauma from people, because it will have the long-term morbidity, even not morbidity and mortality. And this is my opinion, really, our experience.
Thank you, Dr. Halim. I think this is really, I mean, when we talk about health, we always talk about mental health. So one cannot be without the other. And also our city members and our network, they actually also discovered this topic of mental health, that it should be really a priority for them. That's very, very obvious. Yes.
Could I make a point about COVID and its impact on the level of education of people about health? And I think I'm overall quite optimistic about the experience of having lived through a pandemic has brought an awareness, I think, of a number of things to the population that they didn't have before. So I think generally people understand a bit more about viruses and infection than they did before, and about hygiene. I also think in a UK context, there's been an awful lot of attention on things that people can do to protect their own mental health. So, for example, we now have, I think, a much greater orientation and understanding of positive aspects of environment in cities. People are focused on parks and forests and the need for exercise. And I think also a greater awareness of what the consequences of not having good social interaction are for health. And it's a bit of an extraordinary experiment, but if you basically stop people having social interaction, it turns out that it makes them very distressed. And so I feel quite optimistic that although there's been a lot of harm done by COVID, for this generation who are experiencing it, they will take away, so they will have learned something. And we perhaps shouldn't overlook the potential for that. They've also understood the need for government. And they've also, I think, understood the need for governments to be able to intervene. And certainly in the UK context, sometimes that actually where particularly our government is very down on the public sector, they finally understood that you need a public infrastructure to handle these kinds of situations. So I'm optimistic for some of the things that we will have learned.
Yeah, thank you, Rich. That's very good to listen as well to some positive remarks and see it from that perspective. I think that's also true, that we have also an opportunity, and the younger generation is really growing up with these, in these special times, and will hopefully take away some wisdom. Yes. Maybe also Catherine, she's a social psychologist. Maybe you can also contribute something. I'm sure you have something to say, so I invite you if you're online with us. Otherwise, I would maybe go to Monica from the WHO. So it would be also interesting to hear about any experiences you have noticed on the international level, on the concept of neighborhood and health and well-being. Hello?
Hi, I just have my hands raised, and I want to intervene about this adult education with a point. Is Sarah speaking?
Sarah, yes, sorry, you had your hands up. It's true.
Yeah, so basically with this adult education, it is quite important that, as was mentioned before, learning is a life cycle. So, and also it's different to create a demand and offer education to feed a demand. What I want to say is that when you have a society that demands knowledge, that people it's eager to learn constantly, you can offer different content and they will consume that and they will learn and they will be looking for new information. However, when you don't have a society from the childhood that can learn and that they understand something imposed from above, knowledge is something that is part of your life cycle of how you relate with everything and you understand your surroundings. This is different. As mentioned before, one of the presenters, like now people know more about virus, infections, epidemiology.
Right.
Something that is a part of you, you will not looking for that knowledge, and you will not, you will not learn. But if we create a system and the policies and the content is right for the child and the children to understand that it's every concept that they learn is part of what they experience in their daily life, that will make a huge difference. So it's not just the policies, it's the content and how we make a society that demands knowledge to learn and to improve daily. So that's part of what I wanted to say about this adult education, because adults, as the result of how they see knowledge since the childhood.
Yes, yeah. Thank you for these strong words. Definitely, that's very important. The mentality and the attitude towards learning. Thank you so much. I wanted to ask Monica from the WHO if she has some experiences that she can share with us on the concept of neighborhood and health and well-being, linking the habits to enable a neighborhood behavior of learning. Monica, are you with us? Can you hear us? No, maybe she comes back later. We have also, just a second. There is also a remark for Dr. Halim from one of our representatives from our French learning city, Clermont-Ferrand. This is in the chat. This is something for you that you can address about further collaboration. I think we can maybe also focus a little bit more on the link between research and practice and health. So our members, they make the remark that there is not a lot of data available on the linkages between learning and health education. What about this topic about research and practice when we talk about healthy living and the benefits it can bring?
Catherine.
Sarah, can you hear us?
Yes, I'm hearing you.
Yeah. So do you use, do you have a lot of data, research-based data that you can already use for the strategies you're tackling?
Yes, so one of the challenges at the beginning of the pandemic was to centralize all the information here at the health secretary and at the city level to take decisions. So we have a website here that people can see, that is the Observatory of Health, and all the data that was employed to make every single decision is available today, and people can access on a daily basis to also to do their own analysis and to see how we make those decisions. So it has been part of these open data strategies, and so people understand why and what are the basis to make all those decisions. And also all the data that we have about the training and about the access to the medias and to our platforms and to education centers is also available. But these data strategies, I think that is quite important, because it gives also to the society power to analyze and to make their own conclusions about how the pandemic has been managed right now.
Thank you for this very practical and real example. Thank you, Sarah. I might try again with Catherine. She was facing some internet connection problems. Catherine, are you back here again?
Back, Christina. Apologies for that.
Perfect. So Catherine is a social psychologist, and so maybe you can, give some ideas on the digital literacy we were talking beforehand.
Sure. First of all, thank you everyone for your wonderful presentations, but especially Dahak. I'm a social psychologist, not a clinical or counseling psychologist, but I think we're increasingly aware during COVID that mental health is something that we all have. It's just like physical health. And we all have times when we're well and times when we're less well. And some people are more chronically face mental health challenges and well-being challenges. But if there's one thing I can say that's come out of all of these talks is that there's so much shared experience in terms of what we've all faced during COVID and the pandemic. And if there is a silver lining, it's that we are starting to have these conversations, that we're able to remove the stigma that was once surrounded mental health issues like depression, anxiety, and so on. I know Peter and I have written a paper for Pascal about mental health and well-being in cities, and how there's so many beautiful things emerging grassroots from communities, from neighborhoods. I do a lot of work with Food Train. I won't say too much more, but they're a food service for older adults who are very vulnerable. And they've moved from just doing groceries. They now do phone befriending, meal sharing, and all kinds of things during the lockdown to try to look after the most vulnerable in society. So I just want to thank everybody for sharing what's going on in different regions, and just want to say that there is some light, I hope, at the end of this very difficult tunnel, and at least we're having these conversations. So thank you for asking me to share, Christina.
Thank you, Catherine. Thank you. I mean, that's also, again, very nice to have some positive examples. I mean, rather than just focusing on what are the challenges and what's not working. And I think with this attitude, we really have to face the coming year as well, because it is full of uncertainties. So maybe I think now the time has come. I would like to move to our next expert to give us some remarks. I would like to welcome Mr. Peter Cairns. He is in Australia, and it is around midnight, I think. Peter, can you
almost, yeah.
Almost midnight. So thank you for staying up at this time. And so Peter Cairns, he's a member of the Pascal International Observatory Board, and he's a long-standing expert in this field. So maybe you can really share with us what you can take away from this webinar, and give us some of your ideas. Thank you.
Thank you, Christina, very much. I found the discussion very interesting and pointed to some good directions for learning cities that we need to think about, and maybe Raoul's comment about the 5th conference next year are things that can feed into that. I'd like to make 4 points. The first one is the silo joining up, the integration question. And I think that came up right through the discussion. There's some good examples given. Bogota, for example, art and health. That's a very nice connection. And we've seen that in some of the Pascal projects we've been involved in. Creativity and well-being, again, a good connection we need to follow through. We could add to that things like spirituality and health, imagination and empathy and so on. So we need to think in a much more connected way and see how we put these things together and work towards a holistic approach. My second point is neighbourhoods. This was very well made by Rick, and I won't go into this except to say that I think neighbourhoods need to be much more important in learning cities than they have been up to now. We have experimented in Pascal with the learning neighbourhoods. Cities like Cork and Limerick have had learning neighbourhoods, but the connection between the neighbourhood and mental health and well-being and so on is something we need to pursue. So I'm putting the question, what can learning cities contribute in this area? My third point is one Catherine has just made, mental health, the growing importance of mental health. The pandemic, of course, has brought this to our notice, but it had been a trend before the pandemic, and it will continue undoubtedly. In Australia, we've just had a national inquiry on mental health, which was conducted by the Productivity Commission. and it made the point that mental health and well-being is a productivity question as well as a welfare question. So we need to think much more about mental health. My fourth point is to draw to your notice something that OECD has recently set up. They have set up a centre called WISE, W-I-S-E, a very good name. It is the Centre for Wellbeing, Inclusion, Sustainability and Equal Opportunities. So this is well-being in a context where you have to think about it with inclusion, think about it with sustainability, think about it with equal opportunity. OECD has a WISE newsletter that you can all sign up to, and they will be conducting webinars next year on WISE subjects. And Pascal and UIL and Learning Studies are welcome to participate in those seminars. So I think those are the points that stood out for me, except to agree with what Rick said, including that awareness and understanding and consciousness has increased during the pandemic. And this was one good thing to come out of it. So thank you very much for asking me.
Thank you, Peter. And we will definitely take your recommendations up for the next upcoming year. Thank you for sharing the information on the upcoming webinars as well. And yeah, and also that we have to, I mean, that's, I think, what most panelists today agreed on. It's really a much more integrated and holistic view that we have to take on all these topics together. So maybe before giving the floor to Michael Osborne, I would also like to ask, yes, Monica again, and also Dr. Halim, if you have maybe a final remark before we come to the ending of the webinar. Anything that you would like to share with us that our audience can take away?
Christina, if I may.
Yes, please, yes.
So first of all, thank you very much to all of the very interesting and very rich presentations that we heard today. And I think you've managed to really span the breadth of what it falls under this rich area, whether we're talking about medical education, health literacy, resilience, mental health, exposure to health harming behaviors. I mean, this was fantastic, very, very comprehensive, and my congratulations to everybody and also the organizers for succeeding in doing that. I think the challenge that we face as a community, and I count us together as a community from the health and learning side here, is continuing to push this forward and as a common approach, as a common areas with synergies and concrete actions that require distinct cooperation, resourcing and support from both sides. And I think this is we now have over 40 years of evidence that shows us how important education and health are, how synergetic they are, and how the cooperation between the two sectors is fundamental. And now that the realization of that, so taking that into practice, I think is a challenge for all of us. And we know that this goes beyond the scope of what we've discussed today, but it requires being allowed to do so, having the time as individuals, institutional capacity, resources, and also the sort of mutual co-benefits. So when one of our sectors invests, the other one gains, and that's this is not seeing this as a zero-sum public investment is very important, and this requires a slightly different way to how we think about public investments in the public sector. So my closing sort of comment, I think, is that this is we have spoken for a long time about the need to break out of our silos and to use the opportunities of a crisis to really turn our rhetoric and our evidence into action. And I think we're there. We've seen a phenomenal shift in the last 10 months, and continuing in that direction, I think is going to be the way that we succeed to building a better, healthier, more literate future. Inviting me to be part of this conversation.
Thank you, Monica, for these words at the end of the webinar. And the point of investment was also made by one of our participants, and it's absolutely true. Investment in education leads to a better health and vice versa. And yes.
Yeah.
Who was that? Yes, Dr. Halim.
Yeah,
yes,
thank you. I would like to raise the point again that building a learning city is a collective and continuous journey. And we have to replan again. We have to involve people. We have some time to celebrate because of the good point. All people should have access for the all health facilities. We should have monitoring and evaluation, but all of this will not be accessible without good funding. And also, I would like to say that we should take care of our children because they are the future, and we should concentrate more on the mental health. And we should think about that. We should now, I think all the world is one, all of them, they are in one room. Because previously, when we talk about the infectious disease, we say that this person is infected and this person is not infected. But nowadays we observe that that person from the Germany, they may be the cause of the infection in Iraq, and the vice versa is correct. So we should take care of each other, and we should take care of our children, and we hope that in the next year we will meet with each other in one hall, and we will discuss more advanced things. And the last thing will be that we should change our mind. And thank you.
Yes, thank you so much for these nice words at the end. And it's true, we're all sitting in the same boat. So that was absolutely made clear by the pandemic. And it's still, I think this awareness is just, it should be there by now. So Mr. Mitchell or Sarah, anything that you would like to add at the end?
Yeah, so I want to thank for the invitation and the opportunity to share some of the city's strategies on this time, this historical time, and also the opportunity to join the different persons on the meeting. We have learned a lot, all the researchers. So my final point is that learning is a process of understand our surroundings. So understand that we are connecting to the world and that we are part of one world. And it is not just disconnected concepts that are out there that we need to introduce in our minds. It's part of what we are. And when we understand that connection and we are eager to learn more about that, then we will be a learning community, we will be a learning world, and we will not be having discussions on how to induce demand of learning. Is how we're going to be growing to produce more knowledge so people will be learning each day. So the cities also will be demanding for more and more to grow up and feed their spirit with new knowledge. So that's my final point, to also change that mentality, not to feed with knowledge is just to create a demand for people to learn on a daily basis.
Thank you so much, Sarah. Thank you so much to Bogota. I think that's also very useful to hear that at the end. And it's not about information and data only, but really to have a knowledge and to see really the whole vast picture. Mr. Mitchell, anything? Because
I think Sarah said it very, very well. And just to echo what Peter said, I don't have anything to add, but thank you for the invitation. It's been really interesting.
Thank you so much. Indeed. Thank you. I would give the floor now to Mike Osborne, and he's Professor of Adult and Lifelong Learning. He is Director of Research, also at the University of Glasgow, and he's the Director of Pascal. So thank you for your closing remarks.
Thank you very much, Christina. I'm not going to add very much now to what everyone has said. I think we're in agreement as to what the main issues are, and this will be one of the easier reports for me to write in that sense, because I think we've seen many comments which have stressed the importance of networking, of making sure that we get out of our silos, that, and as Rich said and others have said, that there are very many factors here and they're associated with each other and we have to consider them holistically. So really, it's for me to just offer thanks to everyone who's spoken today, to Monica, who gave us a very good initial overview, to Sarah and Azad from Bogota and from Duhok, who gave us two quite different stories of the challenges that they face. In both cases, very difficult challenges and some very interesting perspectives. And in particular in Duhok, which I know very well and which we have connected with for many years, I know what the real difficulties are of the situation that they face. And imagine these situations where they're offering training to their Peshmerga fighters in relation to health and education issues. Rich, who I work with very closely in the Center for Sustainable Healthy Learning Cities, gave us a really good overview of some of the issues from his perspective and put a lot of things in context for us. And I remember very well that street in Kigali that you presented that photograph of. And I would say to people who are listening, do take a look at the work of our center, because we are trying to bring together these issues of health, education, sustainability, very specifically in the context of neighborhoods. Peter, as always, gave us an excellent summary, and I really want to offer thanks to him for being such an inspiration in relation to our work in Pascal. And for those who don't know, he introduced to us the eco-well concept. And if you don't know anything about it, take a look at the Pascal website, which does similar things in drawing together many of these issues. Catherine, of course, always makes fantastic interventions, and she's done a paper for UNESCO Institute for Lifelong Learning on the relationships between digitalization, digital literacy, and learning cities, which will appear in due course. Behind the scenes, thank you to Sergio, who has been transcribing and sending notes over to Hamburg. And of course, thank you to Christina, to Raul, and Konstantinos, the whole team at UNESCO, for, not only for this webinar, but for the other 5 in advance of this, which I think collectively have attracted many, many people and have sent many, many people away with more knowledge about this issue of learning cities contextualized across a whole range of important themes. And I hope everyone who's listening now has got something out of today. It's obvious from the interventions you've been making that you found it valuable. So thanks again to everyone. And now I'll hand back to Christina and perhaps to Raul for some very final words.
Yes, thank you, Mike. That's very, very kind. Thank you as well to you and the whole team of Pascal. Thank you to Catherine and Sergio behind the scenes. Very helpful. And I think we even had 7 webinars in the last months together. And on very different topics. And I think our members and also beyond our network members, they had the opportunity to learn, and even being distant, we could always sense the connectedness. So that was very clear. And I would also now like to thank once again all presenters, all panelists, and all participants today. We had very interesting presentations from Iraq, Colombia, and the UK. And the slides that were shown, you are able to see them once uploaded onto the UIL website. And there will be also a summary of the webinar shared with you. So yes, with saying these last words, I would also like to announce that the next international conference of the UNESCO Global Network of Learning Cities will focus on global health education and emergency response, and that will be in autumn 2021. So thank you very much. And having said that, I will give the floor to Raúl to make his final remarks.
Thank you, Christina. Thank you all. I think that already colleagues gave a very nice recognition to present us to experts. We learn a lot from you, and I think we'll take a good chance to really make it happen, because the world needs it. I think it's also important to really recognize the common work that we have in this series of webinars organized with Pascal International Observatory. It was a great opportunity to all of us really to commit and reflect on the changing world, but also on the role of lifelong learning, the challenges caused by these changes, in particular during the pandemic time. Thanks to all of you, Mike, Catherine, Sergio. I think was really very pleased to work with you. And I will say to the team at UIL, thank you very much, Konstantinos, Christinas, Marie, Katia, for making this happen. I think it was a great opportunity, and it really gave us some inspiration to continue the work on this direction. So thank you very much to all of you, to all participants. It was really nice to finish the series of webinars with this topic that I think is very much encouraging us to make things different. And in order to really learn to take care of ourselves, to take care of others, to take care of the planet. Thank you very much to all.
Thank you, Raúl, for your final remarks. And I will now close the webinar. I wish you all a very nice holiday break, and we see you definitely next year. Thank you so much. Goodbye.
Thank you. Bye-bye to everybody.
Goodbye.
Bye-bye. Thanks.
Goodbye, Sarah.
And sleep well, Peter.